The United States is facing a crisis. It's a silent epidemic gnawing at the soul of the nation. Drug addiction has become a roaring monster, leaving devastation in its wake. The numbers are staggering, painting a grim picture. Every day, countless lives are lost to overdoses, yet behind the statistics lie stories of resilience, hope, and survival. It's a story that demands our attention and action. Forget the stereotypes. Addiction doesn't discriminate. It doesn't care about your race, your income, or your zip code. It can ensnare anyone from the high school athlete to the corporate executive, from the struggling single parent to the teenager next door. It's a complex issue, fueled by a confluence of factors, both personal and societal. The faces of addiction are diverse, reflecting the very fabric of our nation. There's the young veteran grappling with the invisible wounds of war, seeking solace in painkillers that only deepen his pain. There's the single mother working 2 jobs to make ends meet, turning to meth for a temporary escape from the crushing weight of poverty. There's the college student struggling to cope with anxiety and pressure, finding a dangerous release in prescription pills. These are just a few faces of a crisis that has cast a long shadow over America. These are our neighbors, our friends, our family members. Their stories are a stark reminder that the drug epidemic is not some distant problem, but one that touches us all. Numbers can be numbing. They can fail to capture the raw human toll of the drug crisis. But behind every statistic, there's a story of a life derailed, a family shattered, a community forever scarred. These stories are essential. They put a human face on the epidemic, reminding us of the individuals and families whose lives have been irrevocably altered. We hear from parents who have lost children to overdoses, their grief a constant ache. We listen to recovering addicts, their voices filled with both the pain of the past and the fragile hope for a brighter future. We learn from first responders who witnessed the devastation of addiction firsthand, battling to save lives on the front lines of this crisis. These stories, though heartbreaking, are not devoid of hope. They highlight the resilience of the human spirit, the power of community, and the possibility of redemption. They remind us that even in the darkest of times, light can be found in the courage of those fighting for their lives and the compassion of those who stand beside them. Unmasking the American drug crisis requires more than just acknowledging its existence. It demands a deep dive into its roots, an unflinching look at how we got here. From the overprescription of painkillers to the despair born of economic hardship, from the stigma surrounding addiction to the lack of access to treatment, this is not a simple story of good versus evil, of addicts versus society. But it's also a story of hope, of innovation, and of the tireless efforts of individuals and communities working to turn the tide. We can begin to chart a path towards healing and recovery. The seeds of America's current drug crisis were sown long before the first wave of opioid overdoses made headlines. To understand how we got here, we need to turn back the clock. The 1990s saw a shift in the medical community's approach to pain management. Pharmaceutical companies began heavily promoting new, powerful opioid painkillers like OxyContin. This marketing blitz led to a surge in opioid prescriptions. What began as an effort to alleviate suffering opened the door to a different kind of pain. The stage was set for a public health crisis of unprecedented proportions. The overprescription of opioid painkillers was fueled by a perfect storm of factors. Pharmaceutical companies, armed with misleading marketing campaigns, downplayed the addictive nature of these drugs, assuring doctors and patients of their safety. Doctors, under pressure to address patient pain and often lacking adequate training in pain management, readily wrote prescriptions, sometimes for high doses and extended periods. This perfect storm was further intensified by a healthcare system that often prioritized quick fixes over long-term solutions. Patients seeking relief from physical or emotional pain were often prescribed pills instead of being offered alternative treatments like physical therapy or counseling. The result was a nation awash in prescription opioids, creating fertile ground for addiction to take root. As prescriptions soared, so did the profits of pharmaceutical companies. The more pills they sold, the more money they made, creating a powerful incentive to turn a blind eye to the growing crisis they were fueling. This relentless pursuit of profit at the expense of public health would have devastating consequences for communities across America. While the overprescription of opioids played a significant role in igniting the drug crisis, it's crucial to recognize that it didn't spread in a vacuum. The seeds of addiction often take root in soil already fertile with despair, and in communities grappling with economic hardship, social isolation, and a lack of opportunity. The decline of manufacturing jobs, the rise of automation, and the widening gap between the rich and the poor created a climate of uncertainty and desperation in many parts of the country. For those struggling to make ends meet, to find work, to hold on to hope, prescription painkillers offered a temporary escape from the harsh realities of their lives. These pills, initially prescribed for legitimate pain, became a crutch, a way to numb the emotional and psychological pain that was often just as real and just as debilitating. Moreover, these communities, already grappling with a loss of jobs and industry, often lacked access to adequate health care, including addiction treatment. This toxic mix of economic despair, social isolation, and limited access to care created a perfect breeding ground for the drug crisis to flourish. Section 4, From Pills to Heroin, a Deadly Transition. As the supply of prescription opioids tightened due to increased scrutiny and regulations, many individuals who had become addicted found themselves desperate for relief. This desperation created a market for cheaper, more readily available alternatives, and heroin, once considered a drug of the past, made a deadly comeback. Dealers, recognizing a lucrative opportunity, began flooding communities with heroin, often laced with even more potent substances like fentanyl. This transition from prescription pills to heroin, fueled by addiction and driven by desperation, had devastating consequences. Heroin, a much more potent and dangerous drug, led to a surge in overdoses. Communities already struggling with the effects of opioid addiction were now facing a new, even more deadly threat. The crisis, once largely confined to prescription painkillers, had now morphed into a multifaceted epidemic, fueled by a complex web of factors and claiming lives at an alarming rate. The situation demanded urgent attention, a comprehensive response that addressed not just the supply of drugs, but also the underlying social and economic factors that made people vulnerable to addiction in the first place. Section 1. From Heartland to Coastline, a Nation Entangled. The opioid epidemic, once a whisper, quickly morphed into a deafening roar, echoing from the heartland to the coastlines. No longer confined to inner cities or rural towns, the crisis weaved into the fabric of the nation. From bustling metropolises to quiet suburbs and remote reservations, addiction reached far and wide. The face of addiction mirrored America's diversity. The crisis ignored boundaries, uniting Americans in a shared struggle. Section 2, Rural Ruined Farming Communities in Crisis. Rural America, often romanticized for its idyllic landscapes and strong community ties, became an unexpected epicenter of the opioid crisis. Farming communities, once pillars of strength, found themselves grappling with a perfect storm of factors. The decline of small farms and the rise of corporate agriculture created economic uncertainty and stress. Physical demands of farm work, coupled with limited health care, led many to rely on painkillers. Social isolation and long distances between neighbors created a sense of hopelessness and despair. The close-knit nature of these communities meant that the stigma surrounding addiction was deeply ingrained. Seeking help for addiction was seen as a sign of weakness, discouraging many from reaching out. Section 3. Beyond the Stereotypes, the Suburban Stranglehold. The opioid epidemic shattered the illusion of suburban immunity, exposing the hidden struggles lurking beneath the surface of manicured lawns and seemingly perfect lives. Suburban communities, often perceived as havens of affluence and stability, were not immune to the factors that fueled addiction. The pressure to maintain a certain lifestyle, coupled with easy access to prescription drugs, created a dangerous combination. Overworked parents, stressed-out teenagers, and aging adults all found themselves susceptible to the allure of opioids, whether seeking relief from physical pain, emotional distress, or the pressures of keeping up appearances. The stigma surrounding addiction, often even more pronounced in affluent communities, prevented many from seeking help, pushing the problem further into the shadows. The crisis exposed the myth of suburban invulnerability, revealing that addiction could take root anywhere, regardless of zip code or socioeconomic status. Section 4. A generational divide, youth at a crossroads. The opioid epidemic did not spare America's youth, impacting a generation at a pivotal point in their lives. Teenagers and young adults, facing a unique set of pressures and challenges, found themselves navigating a world where prescription drugs were readily available, often within their own homes. The rise of social media, with its curated versions of reality and constant pressure to portray a perfect life, contributed to anxiety, depression, and a sense of inadequacy among young people. The allure of prescription stimulants, promising enhanced focus and academic performance, proved irresistible to some, while others turned to opioids as a way to escape the pressures and uncertainties of young adulthood. This generation, already grappling with a rapidly changing world, now faced an additional threat, one that could derail their futures before they had a chance to truly begin. The crisis highlighted the need for early intervention, education, and support systems tailored to the unique needs of young people, empowering them to make healthy choices and avoid the pitfalls of addiction. Combating the crisis on all fronts. Battling America's drug epidemic demands a multifaceted approach, tackling the issue from all angles. We must confront both the supply and demand, addressing factors that make people vulnerable to addiction. Addiction is a public health crisis requiring a compassionate and comprehensive response. Law enforcement is crucial, but their efforts alone are not enough. We need to invest in treatment and recovery programs. Expanding access to mental health services is essential. Prevention and education are key to creating hopeful communities. This epidemic requires a collective effort for a healthier future. Section 2. Stemming the flow, law enforcement and supply reduction. Law enforcement agencies are on the front lines, working tirelessly to disrupt drug trafficking networks. They engage in high-risk operations to intercept drug shipments and dismantle clandestine labs. Their efforts have led to significant seizures of dangerous drugs, preventing countless doses from reaching vulnerable individuals. However, the fight against drug trafficking is a constant game of cat and mouse. As law enforcement adapts, so do traffickers, finding new ways to smuggle drugs. The rise of synthetic opioids like fentanyl has further complicated the fight. Enforcement alone cannot solve this crisis. We need to address the demand side, providing support to individuals struggling with addiction. Combining law enforcement with comprehensive treatment and prevention programs creates a more effective approach. Section 3. Breaking the chains of addiction, treatment, recovery, and harm reduction. Treatment and recovery programs offer a lifeline to individuals and families desperate for a way out. These programs provide services like detoxification, medication-assisted treatment, counseling, and support groups. They recognize addiction as a complex medical condition requiring ongoing care. Recovery is not linear. It's often marked by setbacks and relapses. A continuum of care ensures individuals have support at every stage of their recovery. Harm reduction strategies such as needle exchange programs and naloxone distribution mitigate the negative consequences of drug use. These strategies are rooted in the belief that every life has value. By meeting people where they are and providing tools to stay safe, harm reduction helps prevent overdoses and connect individuals with treatment. Combining treatment, recovery, and harm reduction creates a compassionate and effective approach. Section 4. Shifting the paradigm, prevention, education, and community engagement. Preventing drug addiction before it takes root is the most effective way to combat the epidemic. This requires a shift towards education, prevention, and community engagement. Educating young people about the dangers of drugs starting at an early age is crucial. We need to equip them with knowledge, skills, and resilience to make healthy choices. Education should go beyond scare tactics, providing accurate information about drugs and addiction. It should foster open conversations, creating a safe space for questions and concerns. Creating resilient communities requires addressing social and economic factors like poverty and social isolation. Investing in programs that provide economic opportunities and improve access to healthcare is essential. By working together, we can create communities where individuals feel supported and empowered. A collective effort can shift the paradigm towards prevention and education. Dr. Sarah Evans, a primary care physician, has witnessed the devastating impact of the opioid epidemic. She recalls a time when prescribing opioids for pain management was commonplace. We were taught to believe these drugs were safe for long-term use, she explains. The faces of her patients began to reflect the insidious grip of addiction. The realization that she had played a role in the crisis weighed heavily on her conscience. It was a wake-up call, she admits. Dr. Evans became an advocate for responsible prescribing practices. She implemented stricter guidelines, screening patients for signs of addiction and offering alternative treatments. The challenges were immense, but she remained committed to finding a better way. We owe it to our patients to provide care that addresses their pain without risking addiction. Maria Sanchez sits in her living room, clutching a photograph of her son, David. David, a talented artist, lost his battle with heroin addiction at 27. He was more than his addiction, Maria says softly. David's descent began with prescription painkillers after a sports injury. What started as pain management quickly spiraled into addiction. He became withdrawn and secretive, Maria recalls. Despite their efforts, Maria and her family struggled to navigate addiction treatment. Stigma, shame, and lack of resources created barriers. Determined to find meaning in her son's death, Maria became an advocate for addiction awareness. We need to break down the stigma and treat addiction with compassion, she implores. Chris Thompson shares his story of addiction and recovery with a room full of strangers. "I'm a recovering addict," he begins, his gaze steady. Chris's journey began with a prescription for painkillers after a car accident. What started as pain management morphed into a full-blown addiction. "I lost everything," he confesses. But even in despair, a flicker of hope remained. A chance encounter led him to a treatment center where he began recovery. Recovery is possible, Chris asserts. We need access to treatment, support, and compassion. His story is a powerful reminder that recovery requires ongoing support and belief in redemption. Section 4. The Advocate's Call. We can't arrest our way out of this crisis. Lisa Johnson, an advocate for drug policy reform, challenges the status quo. "We can't arrest our way out of this crisis," she asserts. "We need to treat addiction as a public health issue." Lisa's passion stems from losing her brother to a heroin overdose after prison. His death ignited her determination to fight for a better way. "We need to invest in treatment, not incarceration," Lisa insists. "We need harm reduction services and to address root causes like poverty and trauma. Everyone deserves a chance at recovery," she emphasizes. Her commitment to justice and reform serves as a call to action. We have journeyed deep into America's drug crisis, exploring its origins and impact. We have listened to voices on the front lines, doctors, mothers, recovering addicts, and advocates. The stories, though heartbreaking, are not without hope. We have seen the resilience of the human spirit and the power of recovery. But the battle is far from over. The drug crisis continues to claim lives and shatter families. Behind every statistic is a story of a life altered by addiction. We cannot afford to become numb to these stories. The fight requires our sustained attention and collective action. The battle against the drug crisis demands our unwavering commitment. Addressing this crisis demands a collective effort. It requires understanding addiction as a public health issue. Each of us has a role to play. We can educate ourselves about addiction and dispel myths. We can challenge our preconceived notions and support community organizations. We can advocate for policies prioritizing prevention and treatment. We can offer compassion to those struggling with addiction. Recovery is a journey, not a destination. Breaking the cycle of addiction requires a multi-pronged approach. We need to support law enforcement efforts to disrupt drug trafficking, but we cannot arrest our way out of this crisis. We must invest in a continuum of care, including prevention, treatment, and harm reduction. This means expanding access to affordable, evidence-based treatment options. It means providing comprehensive support services to address underlying factors. Embracing harm reduction strategies saves lives and connects individuals with treatment. The drug crisis is a battle we can win if we fight together. Let us not allow the enormity of the problem to paralyze us. Draw strength from stories of resilience and hope. This is a call to action for every American. Educate yourself, challenge stigma, support those in need, and advocate for change. Rise against the tide with compassion and understanding. The future of our nation depends on it. The time for action is now. Answer the call with courage and commitment to a brighter future. Don't forget to subscribe and like for more updates and ways to get involved.